Welcome to HIMS TV. I'm Thiru Gunasegrin, APAC editor for HIMS, and today I'm joined by Christian Boucher, Chief Healthcare Strategist for Citrix Systems. Christian, thank you so much for joining us today.
Thank you for having me.
I'd like to begin by touching on digital transformation, which is one of the most important overarching trends in healthcare today. What is your perspective in it? And how do you think technology companies should support digital transformation for healthcare organizations?
Well, I think that's a great question because we've heard that term a lot over the last several years. And what does that mean for healthcare, and what does that mean for more than just the clinical operations within healthcare? We always focus on that. I mean, I think it's important because it's a large part of the operations of an organization, but it also means how are we allowing back office workers to integrate into the solutions. We saw the pandemic and what that did to operations teams. It was very challenging for organizations to be able to pivot in real time to adapt to the challenges of remote work and taking operations and moving them outside of the silos they had been in for decades. The culture has always been, if doctors and nurses are in the room, in the facilities, everyone had to be. Not saying that there were pockets of remote work, mostly for people on the administrative side to log in after hours, but that demand has changed a lot. And I think what we're seeing across the globe is many organizations are realizing that not only can work get done remotely, but it can, in some aspects and in a lot of aspects, it can get done more efficiently. Whether it's, lack of travel into the office or being able to balance work life a little bit better, not being, sitting in a car 2 hours back and forth to work. I can actually work more hours and spend more time at the same time with my family. So it's been a big change. But as we pivot, we talked a little bit about, the back office side, but clinical teams are also facing challenges in digital transformation. How are they leveraging new technologies, new solutions to better serve their patient populations? Whether it's leveraging, mobile devices to become more hypermobile workflows to allow better patient care, or is it, how are we tightly integrating that user experience to collaborate across all those, various solutions they may use at any given time to treat those patients? So there's a lot of different ways we can look at it, but I think for the most part, consumerization has changed everyone's expectations. We all have smartphones, we all have smart TVs, we all have I would say AI-driven personas with all the solutions we integrate with. And I think the expectation has become more and more that we need to bring our enterprise solutions closer to that in order to not only improve all the things we talked about previously, but just overall experience and understanding that when we interact with technology, it should be learning from us as well as, us learning from them. So as we change our use habits, or as maybe my team members are interacting with a new solution or certain files that improve their job functions, maybe it's driving intelligence to make sure that I'm aware of those things as it's happening in real time, so I can see all the new pieces, almost like a news feed. We've seen that across, your Instagram or Facebook, but what is pertinent to what's going on right now? How do we get more information to the hands of the users in real time without having to add excess workflows to their already busy lifestyles? So again, I've kind of talked about various topics, but digital transformation to me means how can we simplify everyone's life by enabling the right technology at the right time, not just throwing new solutions out there without any specific rhyme or reason to it. It has to really take all the things that they need to do and make them simpler to do.
So expanding on that a little bit, because we want to address challenges, what do you see as the biggest challenges for hospitals and health systems in the next 3 to 5 years, and for their IT department specifically?
I mentioned one. I think that consumerization is going to drive many IT organizations to really look at the way they deliver their solutions to their customers. So the doctors, the nurses, the back office, all those different business operations teams as well. But I think the challenges we're going to see driving that is going to be, and I did a little blog before HIMSS earlier this month or last month. Now time flies when you're having fun. But it gets right down to the resiliency of that experience. If I move from location to location, if I work from home or I work from the office, that same user experience should follow me. So that's a big one. Security is not too far behind because we want our users to be able to have access to all the things they need to work on, regardless of where they're consuming those resources are. But we also understand that with this dynamic hyper-mobile lifestyle that we're in now, that there are additional security challenges to deal with. And I think the last one that's going to drive a lot of change is user experience. It comes right down to it. If we can make the user experience, we can call it more pleasant, more adaptable, more consumable by the end user, not only do we make their job a little easier, but more often than not, you can make everyone more productive. If I don't have to jump through hoops to enable this remote secure workforce, and it integrates into my everyday, that makes a big difference. Where something as simple as single sign-on, how has that changed the users' experience levels? Where I don't have to remember 14 passwords, I change one password, it synchronizes across the board, and in most cases, I don't even know my usernames and passwords to those solutions. So while you're also enabling a better user experience, you're building in some security. So that's how you can take that user experience, build in some security, build in some resiliency to it, while still not impacting those end users and how they interact with your technology. Nothing is more frustrating than having to call the help desk for a password reset that you forgot the password for 2 weeks ago because you didn't write it. And of course, all the different policies within organizations make it very difficult with extremely complicated passwords of 20 characters and 3 emojis or whatever it is that people are doing these days. But it really it comes back down to how can we do these things that are required to enable that type of consumer experience while still layering on that security without impacting negatively the experience. Good upgrade to experience is always good, but I've never been told that the security outweighs user experience. It's always been very difficult to make those hard decisions on where's the balance between doctors' experience and the security that we're trying to build in to support their needs. So it's got to be a balance, and I think that's where we're going to struggle, and that's where we're going to see a lot of organizations look to partners like ourselves and others in the industry to help enable that for user populations.
We talked about digital transformation because it is such an all-encompassing trend, but interoperability is another major challenge for the healthcare industry. It stems from the fact that there are multiple systems and applications involved. You have different vendors, different on-premise versus cloud-based infrastructures, and oftentimes conflicting incentives that work against interoperability. What is your perspective on this? And what needs to happen for interoperability to become a reality at scale sooner rather than later?
Well, we've been battling this for a long time, and I'm a big proponent for that the core of what interoperability means for organizations. And we've gotten around it by, implementing interface engines to connect these systems. But, what it comes down to is that adds a lot of complexity to environments. It adds a lot of overhead for IT organizations within healthcare to deliver on everything that their clinicians expect. So, what I foresee and, what we've had some legislation in the United States around is really like anything, we can get into building a security program, building out a clinical program. There has to be policies in place to guide organizations to do this stuff. So I think what we'll see in the next few years is healthcare looking to federal governments and maybe just general clinical oversights to deliver standards that everyone needs to follow to deliver, to allow organizations to integrate their data without all the needless overhead that we have to do now to do that. And even in those cases where we do that, there's always challenges in matching. And I think that's really what it comes down to is organizations that control that, clinical data need to, look at the larger picture of what their mission statements are. We want to be able to deliver, quality care to every single person that passes our door. Now, how do you do that as a vendor? I think we've always been, in Citrix philosophy has always been, we're platform independent. We are hardware independent. We are network independent. You tell us what you want to deliver and we'll get it there on any device you want to consume it on. I think organizations that control that data need to kind of have that same philosophy, because really when it comes down to it, they are the ones that will make that initiative successful or not. I mean, we can do whatever we want on the technology side, and I'm not talking Citrix. I'm just meaning IT leadership in general within healthcare. But really what it comes down to is we need to have those organizations partner with us to find a solution that works for everyone that's at the table. And it's about working together.
My last question is about cybersecurity, a growing problem for hospitals and health systems that is obviously top of mind for IT leaders. As healthcare applications and data are increasingly hosted in the cloud and accessed remotely, and as traditional firewalls no longer offer sufficient protection, organizations are looking for innovative solutions. Does Citrix offer any capabilities that help thwart these cyber attacks and strengthen data security?
Absolutely. Now, we've talked a little bit about, just Citrix in its virtual application delivery platform, or even their virtual desktop. The great thing about our solution is it's very granular in its access. And I'll talk about the security piece we've now, I'll say the enhanced security piece we built into our solutions. But even at its core, the virtual apps and virtual desktops are now, Citrix DaaS services. Give you a lot of control on how solutions are accessed within your organization. And what I mean by that is that, I maybe walk into the office and within a hospital, and I have access to all these applications. I can print, I can copy and paste, I can download files, I can do a bunch of different things within this environment. But when I leave that office and maybe I go to the coffee shop down the street and I'm on the Wi-Fi and I still need to interact with that data. How do you now change in real time? How do you change how those security policies are applied? That's where we come in, knowing that we have insights all the way down to from data center, or we'll call it data location, all the way down to the endpoint. We have insights to everything that goes on. So when they switch from a trusted network to an untrusted network, we can layer on security automatically to disable certain features like being able to print or being able to screenshot or whatever it may be in real time without user interaction. I don't have to log back in. Or maybe, I'm a doctor and I go home and I want to do some of the same things I do in the office. But now I'm on an untrusted network. I'm on an untrusted device, unmanaged device within my home, accessing these things, which I can through Citrix. Now we can layer on additional technologies, allowing them not to be able to print, not to be able to even open certain applications. Even though my application portal looks the same, I might not be able to launch that. Or maybe I'm just going to make, I'm going to trigger a secondary multi-factor authentication on their mobile device that's managed. So we give a lot of flexibility in how you deliver security, and we give you the insights to make sure that you're adding it at the granular level at the right time. Now, our SPA solution, which is recently released, so Secure Private Access, is I would call the second story to our building on the security platform, where we give you a lot more granular access, not only to give you those controls for virtualized applications within your data center, but also now extending that out to cloud services as well as SaaS-based applications. So as organizations start adopting some of these newer technologies that may not reside in the data center and give them all those, we'll call it firewall-based controls, we now can extend those same security services out to those ancillary solutions where they may not have physical control of those environments. And again, giving you very granular control that you as a customer can decide based on your internal policies to layer on as you find appropriate across the entire spectrum of, trusted devices, untrusted devices, trusted and untrusted networks, various data locations, or even, maybe it's just specific data types that you do not want access remotely at any cost. So we give you the controls to make sure it's as functional as you need it to be and integrate with across all the various platforms that you may want to use, whether it's various, single sign-on providers or identity providers or SaaS providers. And I think that really separates us in the market by not only giving you, control of the things that you can control, but also control a lot of things that you cannot when you start looking at cloud and SaaS solutions.
This has been a fascinating conversation, Christian. Thank you for sharing your thoughts.
Thank you very much. Have a good day.
You too.